Hi, great to have you here, Lauren. Could you introduce yourself, who you are, and why are you looking forward to this series, and what are the key topic areas that will be covered?
Wonderful. Thank you, Janice. Thanks for inviting me here. So my background, I've worked in health and aged care for many years. I have a real passion for this area and started a technology and media company really to look to solve some of the big challenges in the sector, which is really around the quality of life and quality of experience for older people. And that's kind of where it first started from. And I'm really excited about being part of this leadership series with Aging Asia and yourself, Janice. I think it's really important at a global level to raise some of these really important topics that we're discussing in the series, and having leaders globally share their views and their perspectives. It just means that it opens up our thinking more broadly. And, I think it's easy to get very focused on, the country that you live in and get very insular in your thinking. But I think what Aging Age has managed to do really successfully is to be able to open it up at a global scale and share what even those different cultural challenges, there's some very similar issues for older people aging, and particularly when they're living in aged care. So this series is plays a really important role, and as CarePage and our company, we're very excited to be a sponsor of this series.
Tell us more about the trends that will be part of this series.
Yeah, so the first one out of the four is on tech solutions and tech trends. So we've got a range of different speakers that really look at how they're using technology within their organisation, the impact it's having on seniors or residents in their care, and really looks, across the globe how, whether it be in use right now or it be something, in the next sort of 5 to 10 years where they see the tech trends moving towards.
Talk about the second key trend. Tell us about the second trend.
Yeah, so the second one is really on innovations in the overall different models of care. So, as I said earlier, there are a number of similarities as we age and for residents living in residential care. However, what we start to see in individual local levels, how organisations are doing things slightly differently. So we do have across different countries the opportunity to speak to many of the leaders and to see how they put their models of care into practice.
Great. Tell us about the third topic that we'll be hearing from.
The third one is on quality of life and quantity of life. So that's something that's, I think, really pertinent to why we are all doing what we're doing and working in this area. There's a lot of discussion over, quantity of life, and as we start to, live longer, is that reflective in being a quality of life. And we've talked to many leaders in this series on what they are using to measure quality of life, and the importance of measuring quality of life at their, both at a management and board level. So that one is definitely one that's very important, and the theme that we're seeing across the board.
What is the last trend in terms of community builders and integrated care leaders?
Yeah, so that really looking at, as we start to age and looking at what providers actually do offer residents or seniors living in these communities. So there's been more of a push on wellbeing and lifestyle, and, looking at how we support the older person from, when they're starting to slowly deteriorate through to when they're much higher level needs. So that whole continuum of care. So we've spoken to a number of leaders in this area and organisations that have models that are really geared around supporting seniors. And it's really interesting to see what different countries are doing in that space.
What does care leadership mean to you?
Well, if I think about my personal journey and why I, got into this sector, it was really from, a purpose of really having a passion towards older people and really wanting to see, their rights, to see better improvement of their quality of care. Knowing that not all older people receive good quality of care at the end of life or as they start to need it. And so that was something that I became very interested in and very concerned about, that not all older people were receiving quality of care. So that really is what led me on this path and a purpose. And, when I first started there, it was really myself to begin with, and now to have built a team of other passionate, like-minded people is, that actually believe in the cause, is what I think makes it all the worthwhile.
Wonderful. And what is your care philosophy, if you can share with us?
My care philosophy is that all older people deserve quality of care, and regardless of your background, regardless of even what you've done in your throughout your life. I think once someone starts to age and they start to become more vulnerable, I strongly believe that everyone deserves the same level of care and respect and dignity as the person next to them. And that's something I'm very passionate about.
Okay, being CEO of CarePage and editor of Hello Care, you must have come across many interesting interviewees and seniors in your interaction, and there must be a story that really has touched your heart when interacting with them. Can you share with our audience today?
Yeah, definitely. And, I have had the opportunity to meet many amazing older people living in care. I think, often from day to day, I think the care staff actually often get very busy. I think it's easy to forget about the amazing lives that a lot of the residents have led. So, I'm in a great position that, the opportunity to go and tell someone's story and allow that to relive is so vitally important. But one, I guess, that really is very close to my heart is a resident that I used to volunteer and visit is Ladislow, and he didn't have any family and friends, and I would go and visit him every, second week as a community visitor, and it was just super rewarding for me. I would leave there thinking that my cup was filled up, and I could see the impact it was having on him, and I knew that if he it was just, it just showed that such a small gesture could have such a large impact on a resident's life. So from that, really, to be honest with you, is kind of some of the initiatives and things that we've gone about is to try and assist those that don't have regular visitors. And there is a large number, whether it be in Australia or globally, residents living in care that don't actually have regular visitors.
Great. And you also have a lot of experience and interactions with the various tech implementations you've come across the years, and especially with your background as a nurse too. What are some of the tech implementations you've come across or CarePage has developed that can really help to provide better care for older people?
Yeah, I think at the end of the day, and like any service that anyone provides, regardless of the industry that we're in, it's most important that we actually hear from the end user or the person that's actually receiving your service on their feedback. And I've always taken that approach, and hence why in the software space we really got into that voice of customer or voice of resident program to really enable senior leaders to hear at a ground level, particularly if you own a number of individual services, it's very hard to keep your finger on the pulse or get an overall sentiment on a day-to-day basis or monthly basis. So that for me is where I see it's, if we start there, listening to the voice of your resident or your clients should take, a large percentage of to understand your overall performance, along with other things like clinical indicators or clinical software. So they're two kind of really important aspects of providing care.
And how do we relate this to delivering a good quality of life for residents, especially those living in communities? How important is measurement of quality of life?
Yeah, I mean, I think having, if we don't measure it, then we don't know effectively. So having some sort of a baseline assessment as to how, when someone first enters your service or starts to use your service, what their quality of life is. Some, providers can have an impact on whether that improves or whether that declines. There's some things that you obviously can't improve because they're more personal in nature. And if you're looking after 130 residents, you can't fix everything for everyone. But there are things that providers can do, but it really starts with that first, measuring, because you can't change what you don't know and what you're not measuring. So that's where I would, where our focus has been on, is enabling providers to measure.
Fantastic. And how do we link or establish a relationship between delivering good quality of life and quality of care? In our quest to want to do things for older people, does that mean that we want to do as much as possible for them? And how do we make sure at the same time they are also enjoying this level of clinical care? Do you think that we tend to overdo things, or what do you see as the biggest link between quality of life and quality of care?
I think there is, I think, from care workers or nurses or people working in that space, there is a natural, I guess, transition to wanting to always help people, to wanting to do things for older people, but sometimes it's at their own detriment, because then they then not doing things for themselves. And it's that self-determination for them actually wanting to, be able to, pour themselves some water, be able to shower themselves, be able to go and open the door themselves. Whilst it might seem like a small thing for us, for older people, it's actually, that's part of them maintaining their independence. And as soon as that starts to break down, the sense of self, the sense of, that self-determination actually starts to break down. And that's where we start to see decline in one's overall health and well-being, is when they no longer can do anything for themselves. They don't have a sense of independence. So I think it is, it's hugely important. It's not always easy to do. And I think, the system, or the way that nurses and carers are taught, is to care and to do for others. But sometimes we have to step back and think, how can we enable them to do some of these things themselves?
Great. I think that's a great part of the overall vision that can help improve life for older people. And now we want to take our conversation a little bit further to one of the biggest tech trends now, which is data analytics. More and more care organizations are starting to resemble tech firms, with a huge team that looks after their technology and the analysis of the data. How important do you think data analytics is to track quality of life and quality of care, to provide the care leaders more tools in order for them to evaluate their operations?
Yeah, I mean, I think it's hugely important. And, typically, from a middle management perspective, middle managers are really focused on the clinical aspects in most instances. They have more recently had more reporting thrown at them, but they don't have a huge amount of time to be able to analyze the data. So often that in the past, historically, is where that's sort of fallen down, because you don't have a huge amount of time. By the time you get the data in, and if things were manual, there wasn't enough for the analysis. So to be able to have as an organization, as more and more organizations mature in terms of their reporting function, being able to analyze that data and have it in a format that you can easily analyze, it's more and more important. So you can actually start to see what are trends, where are systemic issues across the organization, or where more individually, at an individual local level, that there are issues or things that could be improved at a individual resident level. So yes, I think it's hugely important. I think many organisations at that analysis stage are still at their infancy stage, I would say, because it does take a lot to kind of, it's all right to have that data to report on, but it is always that analysis and then that, more deeper dive that takes a bit more time. And it actually is a skill that, not all middle managers will have. It is, that's why we have data analysts. It's a totally different role to a facility manager. Yeah.
Good. You've developed a tool that can measure and look at how we can improve care for residents. Can you tell us more about this tool?
Yeah, definitely. So really, we've worked over many years with aged care, home care, retirement operators to look at how we can measure the voice of the resident, the voice of customer. So we've built a product that's web friendliness for people with low vision and for disability, supports people with cognitive impairment to be able to give feedback as well, because often that's a cohort of people that as soon as we're told they have a diagnosis of dementia, automatically not asked for their views because the system or the tools weren't set up for them to actually input data. So the product is really built for the sector. At the end of it, providers at an organizational level get deeper analysis on their data or reporting on analytics so that they can see any areas for improvement and continuous quality improvement so that they can actually start to feed that into their plans for continuous improvement and start to look at how they make changes across their organisation based on what the resident sentiment is.
Wonderful. Well, that's a fantastic overview of how we look at care leadership and onto the key trends of quality of life and how we can use data analytics to help us improve the delivery of care better. Well, we have time for just one more question. And this question is really about one of the biggest issues that's bugging many care operators today and keeping them awake. How can we motivate and develop more talent for the care sector?
Well, that is a tough one. But I would say, for many people working in this sector, it's not, it's really from a passion. It's particularly those that thrive, I would say, in this sector, is it comes from a passion. There's either some interest or, prior experience or personal experience with working with older people. So that's probably one of the key drivers. So I think it's really then understanding, at an individual level, it's hard to sort of make a broad brush approach for everyone, but understanding their values and what are their key motivators. And really it's in many instances where we've done our own, I guess, research with aged care workforce is on feeling a sense of, feeling valued. That's probably a key thing, is feeling valued for their work and rewarded. So that doesn't necessarily mean financial reward. It could just be a more, a public acknowledgement of what they've achieved, or, a gratitude. A thank you goes a long way in this sector. They're not expecting an award every day of the week, but if they've done something or they've stayed back, just the acknowledgement that they've actually done that, and it is relatively, you think it's relatively basic, but it's not always done, unfortunately. I think probably also finally is the culture in some organizations. I think there is still a hierarchy approach that starts from, probably in, head office through to middle management, like the facility manager, and then there's a big hierarchy that goes underneath that, and that's still, I think, breaking down some of those barriers and really working on that company culture is really important, because that's reflective then in the care that's received to residents when there's unsettlement, any toxic kind of interactions at that level is where we start to see impact on resident care.
Great. Thank you so much for your time today. It's been a wonderful session and we've heard so many key insights. And those of you interested, do drop us your comments. And we look forward to everyone enjoying really this entire series that we've brought to you. Thank you.
Thanks, Janice.
CarePage Business is the only feedback platform designed for the health and aging sectors. With CarePage Business, you can uncover powerful customer experience insights, monitor resident or client feedback and complaints in a single, easy-to-use platform, and get the insights you need to drive continuous improvement in services and facilities.